I think here comes the Chancellor now.
Good evening. I'm joined here in Downing Street by Professor Stephen Powis, Medical Director of NHS England. Let me begin tonight with the latest figures. 4,043,686 tests have been carried out in the UK, including 131,458 tests yesterday. 271,222 people have tested positive, an increase of 2,095 cases since yesterday. Sadly, of those who tested positive for coronavirus across all settings, 38,161 people have now died. That's an increase of 324 fatalities since yesterday. Our thoughts, as always, are with the family and friends of those who have lost their lives. Today's figures confirm what the Prime Minister has said. We are past the peak, we're flattening the curve. We protected the NHS and the number of deaths is falling. Over the coming weeks, we can now take careful but deliberate steps to reopen our economy. Across the country, office lights will be turned on and windows thrown open. Work clothes and school uniforms will be pulled out of the wardrobe. Shops and factories will start to hum with activity. As we enter this new phase, things will change. Businesses will need to become COVID secure to protect staff and customers. We will all need to stay alert as we go about our daily lives. And as Britain returns to work, we need to adapt the emergency programmes we put in place to bridge through the crisis. Because of those programmes, our economic prospects are better than they otherwise would have been. We have provided tens of billions of pounds of tax cuts, tax deferrals, cash grants and discounted loans for businesses, income protection for millions of the self-employed, a strengthened safety net to protect millions of our most vulnerable people, and our job retention scheme has now supported more than 1 million jobs and over 1 million businesses. No British government, Labour or Conservative, has ever done anything like this. I believe it has made a real difference. But as we reopen the economy, there is broad consensus across the political and economic spectrum. The furlough scheme cannot continue indefinitely. 2 weeks ago, I outlined the principles of my approach. The furlough scheme will remain open all the way until October. We will ask employers to start contributing as we also introduce flexible furloughing. And employees will see no change to their level of support. As promised, I can provide more details today. I believe it is right, in the final phase of this 8-month scheme, to ask employers to contribute alongside the taxpayer towards the wages of their staff. But I understand too that businesses and employers have been through an incredibly difficult time. So I have decided to ask employers to pay only a modest contribution, introduced slowly over the coming months. In June and July, the scheme will continue as before, with no employer contribution at all. In August, the taxpayer contribution to people's wages will stay at 80%. Employers will only be asked to pay national insurance and employer pension contributions, which, for the average claim, account for just 5% of total employment costs. By September, employers will have had the opportunity to make any necessary changes to their workplaces and business practices. Only then, in the final 2 months of this 8-month scheme, will we ask employers to start paying towards people's wages. In September, taxpayers will pay 70% of the furlough grant, with employers contributing 10%. In October, taxpayers will pay 60% and employers will contribute 20%. Then, after 8 months of this extraordinary intervention, of the government stepping in to help pay people's wages, the scheme will close. The biggest request I've heard from businesses, large and small, right across our country, is to have the flexibility to decide what is right for them. So, to protect jobs and help businesses decide how quickly to bring their workforce back, we are introducing a new, more flexible furlough. This is a critical part of our plan to kickstart the economy. The financial security of the furlough scheme has been a relief for many, but at the same time, people want to work. No one wants to be at home on furlough. No one wants to feel unable to contribute. So HMRC and the Treasury have worked hard to put the flexible furlough in place, not from August the 1st as originally planned, but from July the 1st, 1 month early. From July the 1st, employers will have the maximum possible flexibility to decide on the right arrangements for them and their furloughed staff. For instance, if you were watching at home and on furlough, your employer could bring you back 2 days a week. They would pay you for those 2 days as normal, while the furlough scheme would continue to cover you for the other 3 working days. To allow us to introduce this new flexible furlough from July the 1st, we will need to close the old scheme to new entrants on June the 30th. Employers wanting to place new employees on the scheme will need to do this by June the 10th, to allow them time to complete the minimum furlough period before then. Alongside the furlough scheme for employees, our economic response has also supported the self-employed. 2.3 million people have now applied for our income support scheme. I know people have been waiting to hear whether the scheme will be extended, and I understand people have been anxious. I can confirm today the self-employment income scheme will be extended with applications opening in August for a second and final grant. The final grant will work in the same way as the first did, paid out in a single instalment covering 3 months' worth of average monthly profits. To maintain the sense of fairness alongside the job retention scheme, the value of the final grant will be 70%, up to a total of £6,570. Otherwise, there will be no changes and no further extensions to the schemes, which continue to be some of the most generous in the world. Our economic response to coronavirus was designed to keep people in work, protect people's incomes, and support businesses, all to give us the best chance of recovering quickly as the economy reopens. These measures have been on a scale unmatched by any government in recent history. But I do want to acknowledge that we haven't been able to support everyone in the exact way they would want. I understand some people have felt frustrated, but you were not and have not been forgotten. Even if you don't qualify for the furlough or self-employment schemes, we've provided a wide range of support, from discounted loans to tax cuts, mortgage holidays, and enhanced welfare. Now, our thoughts, our energies, our resources must turn to looking forward, to planning for the recovery. And we will need the dynamism of our whole economy as we fight our way back to prosperity. Not everything will look the same as before. It won't be the case that we can simply put the key in the lock, open the door, and step into the world as it was in January. We will develop new measures to grow the economy, to back business, to boost skills, and to help people thrive in the new post-COVID world. Today, a new national collective effort begins to reopen our country and kickstart our economy. Thank you. Steve.
Thank you, Chancellor, and good afternoon, everybody. I'd like to take you through today's data slides. The first slide, as ever, provides some data on social distancing and how our response has been to our social distancing guidelines. And this is information coming from the Office for National Statistics, Opinions and Lifestyle Survey, 21st to 24th of May. And that shows that 88% of adults have avoided contact with older and vulnerable people, that 98% of adults have said that they have tried to stay at least 2 meters away from other people when outside their home. 29% of adults are now using a face covering, when outside their home to slow the spread of COVID-19. And 39% of adults in employment have been working from home, compared to around 12% last year. So again, good evidence of compliance with social distancing measures. The next slide takes us into testing and the number of new cases. And as you can see in the top graph, the number of tests undertaken each day has been increasing, and that's increased very much during April and into May. And you can see that that number continues to be at a level above 100,000. On the bottom graph, you can see the new confirmed cases that have come out of that testing. And you can again see that there is a steady decline in those numbers, particularly noticeable on the 7-day rolling average. But as I think the Chief Scientist said yesterday, the Office for National Statistics survey of random household individuals show that there are indeed more cases than are coming forward as part of this testing programme. And now that Test and Trace is in place, we anticipate that that gap might close between those two figures. Next slide. So now we look at data from hospitals. So the first shows the estimated new daily admissions with Covid-19 in England. That's the top graph. And you can see that there has been a steady decline in the number of new daily admissions since the middle of April. And that decline is still there, perhaps slowing a little, but we are still seeing that decline. In the bottom graph, you can see data concerning our sickest patients. Fortunately, those that require treatment on our intensive care units and require mechanical ventilation. And this is expressed as a percentage of our total mechanical ventilator beds occupied by Covid-19 patients. And you can see that in all 4 countries, that again has been steadily declining since April, again showing the effect of social distancing measures in our sickest patients. And that is a decline down 13% from a week ago, the 21st of May. The next slide shows more information on hospitalisation. So this is people in hospital, overall people in any bed with COVID-19. 8,287 people in hospital, down from 9,397 last week, so a drop of over 1,000. The graphs show that on a regional basis. You can see throughout the UK in the devolved administrations that there are steady declines throughout. Again, as I've said before, the most dramatic decline has been in London, which had the most dramatic peak and the highest peak in April. In the next slide and the final slide, we move to deaths, again, the saddest component of this data set. Again, you can see that the key measure here is a 7-day rolling average, which takes out the variation that we see from day to day, and particularly the reporting variation at weekends. And you can see that the 7-day rolling average is continuing to decline, and the Chancellor has provided information on the deaths today, 324 in all settings, deaths confirmed with a positive test. Thank you.
Thanks, Steve. If we turn to questions from the public, can we start with Will from Manchester?
During lockdown, there's been a drastic fall in CO2 emissions, and many of the changes to our lifestyles and sacrifices we have made will help tackle climate change. What, specifically, are the government doing to maintain these low emission rates as lockdown is eased, and will these concerns be central to rebuilding the economy?
Thanks, Will. Really important question. What I'd say, a couple of things. The most obvious and immediate change that we've seen is how people are getting around, commuting, seeing people, and using cycling. And I think that is a trend that hopefully will stick. More people have discovered cycling. That is something that we can all do. Good for the environment, but also good for our health and well-being. To your broader question about climate change and tackling net zero being part of our economic recovery, absolutely. In March, which seems like a very long time ago now, we had a budget, and in that budget I talked a lot about our future plans for investment and in growth, and mentioned a range of different initiatives that we're going to take forward over the next few years for this agenda, one of which is preserving our natural capital, and we have a new Nature for Climate Fund that will be investing in our environment. I also talked about the importance of something called carbon capture and storage, storage, a technology which will take carbon from the air and sequester it underground. And we said that we will invest several £100 million over the next few years in developing that technology. That could benefit thousands of new jobs in places like the North East, in Teesside or Humberside, where the conditions exist to do something like that, and I believe we can be a world leader. So absolutely right, it's important now in our change behaviour, we should keep that, but lots of exciting plans for the future as well. I don't know, Steve, if you ever want to add anything on.
Well, I will add something, because in the NHS we are very much concerned around playing our part to reduce emissions and to help protect the environment. And the long-term plan that we published over a year ago really did focus on this too. If I give you one specific example, one of the things that we wanted to achieve in that long-term plan was to significantly reduce the number of face-to-face appointments in hospitals. A lot of those appointments can be managed remotely, digitally, on the telephone, by other methods. And in doing that, we knew that we would cut down the amount of NHS-related transport that people need to use to get to those appointments. And we have estimated that up to 5% of traffic during a normal week might be NHS-related. So that would have a significant impact. And of course, it would protect some of the patients that we have to see. So our respiratory patients, our patients with chest disease, who of course can be affected by pollution in the environment. And I think one of the things that we have seen during the coronavirus crisis over the last month is that we have moved very rapidly to implement some of the changes that we wanted to make. So we have very much increased the number of remote, digital, telephone consultations, both in hospitals and in general practice and in other aspects of community and primary care. And we really want to hold on to that. That was something we were going to do anyway. And so as we come out into the new world of managing COVID going forward, we want to ensure that we keep that approach as much as possible to benefit patients, to do things better for patients, more simply for patients, but also to protect the environment.
Brilliant, thank you. If we turn next to Simona from Eastbourne with a written question. Simone is asking, what is the government doing to support women returning to work from maternity leave and who have no childcare and can't be furloughed? Simona, thank you. So there's a range of measures that we've put in place, and the various schemes that we have will benefit people in different ways. Obviously, the furlough scheme is there. We also, for those who are self-employed, have the self-employed income support scheme, which is helping many people as well. Beyond that, for those who may run their own business, we've provided tax cuts and temporary discounted loans to help bridge through the crisis. And of course, crucially, we've strengthened the safety net for those who are most vulnerable in our society with temporary increases to universal credit, to working tax credits, local housing allowance to help with rent payments alongside mortgage holidays, and providing councils with a fund to help people pay their council tax bills if they're facing difficulty. I think importantly, though, is that because of the hard work of everyone and the progress that we've made, we are, as the Prime Minister announced, able to start reopening our primary schools from the 1st of June, starting with our youngest children, those in the earliest years settings and some of the first couple of years of primary school. And I think that will help allow more people to get back to work as we can reopen our schools and allow children to come back to those settings as well. Great. I think if we turn to some questions from the media, I think first up, we've got Faisal Islam from the BBC. Faisal, are you there?
I am, Chancellor. Thank you. Just in the first instance, is your general message to workers who work for companies without the cash flow to pay even national insurance and pensions contributions, and to the self-employed after autumn, that 100 billion is your limit and unemployment will spike? And then more generally, to Dr. Powis perhaps, what is happening with the assessment of the Joint Biosecurity Centre? A lot was made of this by the Prime Minister when it was first announced that the lockdown was to be loosened. Is it at 4? Is it at 3? Is it between 4 and 3? And if it hasn't gone down, why are we loosening things up?
Thanks, Faisal. So in terms of your question about the employer contribution and will employers be able to meet it, well, I'd say a couple of things. First of all, in aggregate, the scheme is, I think, very generous. 8 months is a long time to have the support. If you look at the total employer contribution over that entire period on a typical employee, average employee on the scheme, it will amount to the employer making a 5% contribution of the total employment costs they would have otherwise have faced over those 8 months, they'll actually only have to contribute 5% of that if they were there for the entire time. So I do think that is reasonable and affordable. In that first month that you talked about in August, because we're only in that month asking employers to contribute national insurance and the auto-enrolment pension cost, we know from the numbers that we have that around 40% of all employers currently don't pay those at all because they don't quite they're not eligible to have to pay them. So in the first month, around 40% of people won't be affected by that change at all, which gives all of those probably smaller companies an extra month of breathing room. In terms of cash flow, which I think is a very fair question, we're very focused throughout this entire crisis on making sure we provide liquidity support to businesses. We have a range of loan products available which have proved to be successful. 600,000 bounce-back loans have now been issued to small businesses up and down the country. And with the furloughing schemes, we've designed them in a way that companies can apply in advance of payroll, so they receive the grant from the government so that it can help them use that grant to pay their payroll as well, which was a big ask from business, and we were able to design the schemes in a way that did that, which also will help with cash flow. Steve, do you want to take the other question?
Yes, thank you, Faisal. So on the Joint Biosecurity Centre, as you probably know, that is currently under development. It is setting itself up with advice from various government departments. I know it is feeding its information, even at this early stage, into the 4 chief medical officers who have to think about alert levels across the countries in the UK. I think from the NHS point of view, if I can speak from the NHS point of view as NHS National Medical Director, one of the key things that we need to ensure is that we are linked into the Joint Biosecurity Centre so that any changes in alert levels or any changes in early warnings around the transmission of the virus can be used by the NHS in determining its planning going forward. So we need to be able to respond, as we did so magnificently in April, to a surge. If we see a change in the amount of infection in the community, the NHS needs to be able to do that again. So for us, it's really important that we link in to the centre so that we have that dialogue and understand when we might need to adapt what we're doing.
Faisal, anything to follow up on?
Just can I check that 100 billion number? Is that roughly what we're looking at for the total cost of the 2 schemes over 8 months? And then again, just to Dr. Powis, what has gone on with the testing numbers? For 6 days, we didn't have people tested numbers. Have you sorted out whatever the problem was there?
I think, Faisal, in terms of the cost estimates, as you know, the Office for Budget Responsibility have provided a range of estimates, which I would point you to. And we publish, obviously, a weekly a calculator or weekly projection of where we are in the scheme and the total claims. It's difficult now to say what the aggregate cost over the entire life will be, because now that we've introduced part-time furloughing for the last few months of the scheme from July, that will obviously adjust people's working patterns, bring people back from furlough into work. It's difficult to predict precisely exactly how that will work, so I can't give you a precise estimate, but I would refer you to the OBR numbers, which I think you referenced, which are probably the best estimate that we have at the moment from anyone who's looked at this in detail.
I can't give you a specific answer on the testing numbers, but testing is increasing all the time. And this week we have started adding in the antibody test, the serology test, that tells you whether you have had the virus rather than whether you've got it. And that is being rolled out now in hospitals and healthcare facilities as we speak.
Brilliant. Thank you, Faisal. If we could turn next to Ed Conway from Sky. Ed?
Yeah, thanks, Chancellor. I mean, this feels like a big moment because it's kind of the moment where you're beginning to take the UK off this extraordinary support scheme. Is it fair to say this is, in kind of economic terms at least, is where the easy bit ends and the tough bit begins, so unemployment rises potentially and so on? And how tough a period do the British people need to prepare themselves for? And if I could just ask one other question supplementary to that. I noted you're calling this the flexible furlough scheme, which kind of raises a bit of a question. In the event that there is a second spike in the virus involving some more lockdown measures, will you undertake to switch the furlough scheme back on? Or once it's over, is it just over?
Thanks, Ed. I think, after your first question about difficulty, I'd say look, many businesses already have been facing an enormous amount of difficulty. Many people have already been facing an enormous amount of difficulty. And you asked about unemployment. Despite this extraordinary and significant intervention that we've put in place, I can't and we can't protect every single job and every single business. I have aimed and tried to make the scheme as generous as possible in terms of its duration, its flexibility, the contributions we're asking, to try and protect as many of those jobs as possible. And indeed, people like the Office of Budget Responsibility or Bank of England, or indeed I think today the Institute for Government, have talked about the fact that the scheme has achieved that aim and will mean that we are in a better place than we otherwise would have been. But I agree with you, there will be hardship ahead for many, and that rests heavily on my shoulders. I'm very conscious of that, and we are working very hard, and I will work very hard to make sure that all of those who do lose their jobs as a result of what's happening, that I'm working as hard as I can to get them back into work and good work as quickly as possible. With regard to the scheme, as I said, this scheme, as it stands in a national way, in the way that it's designed, will end in October. But if you look around the world at how long people have put these in place for, I think that compares very favourably. 8 months, as I said, is, I think, a generous and long period of time and allows companies across the UK to slowly ramp back up and gives them the best possible support that it can to do that. Steve, anything? I don't think there were no other questions. Ed, do you want to anything else follow up on?
I mean, sorry, since I have a chance, I will. But because you talked about planning for the recovery, and as part of that, you might well need extra tax measures and stimulus measures to try to get the economy going. You talked about kickstarting the economy. Can you just give any sense as to what that might comprise, and in what form at least might we hear about it? Is there going to be an emergency budget, perhaps?
When I'm always asked about these things, you'll forgive me for giving the same answer to all of them, Ed, which I can't and won't talk about future budgets today. But in terms of the format or timing of that, of something like that, rather than the content, what I had said previously is that I was planning to have an autumn budget to get us back onto a cycle of autumn budgets. As you well know, we release the timing of events like that in the normal course of business, and that's exactly what we would do. Brilliant. Thank you, Ed. Next, Andy Bell from Channel 5. Andy, hello.
Yes, hello. Thank you very much. For the Chancellor, Chancellor, the government's always said it's following the science on its dealings with the coronavirus crisis, but Downing Street this morning confirmed that the alert level remains at 4. The Prime Minister had said he was hoping it was going to go down to 3, but it remains at 4, we're told today. And under the government's own definition of these levels, it's only at 3 that you can have the gradual relaxation of restrictions, but we're going ahead with the relaxation of restrictions, certainly in England. Does that mean we're no longer following the science? We're prepared to take decisions based on other factors? And Dr. Powis, how worried are you that we're just being a little bit too risky about how we're going forward with relaxing these restrictions?
Andy, in terms of moving forward, what we've always said is we've set out the 5 tests very clearly, and because we are now meeting the 5 tests, because of the heroic efforts of everyone at home, the NHS, everyone, we're in a position to carefully and deliberately start to release the restrictions. I wouldn't say that that's happening in a reckless or big bang way. As the Prime Minister set out, it's being done in quite a measured and phased way, progressively, to make sure that we can keep an eye on things and we're not running before we should. So, my view is we've set the tests out. We are meeting the test, and therefore we're in a position to do these moves. They are progressive and measured moves. We constantly are keeping an eye on everything, and I think Steve would probably echo that there's been no change in the dialogue or the relationship we have or the advice we receive. We remain very cognizant of the scientific advice, very engaged in it, and listening to it very strongly.
Yes, well, as you know, the important thing is to keep the transmission rate, that R rate, below 1, because that means that the number of infections is declining over time rather than increasing. And of course, we all want to ensure that remains the case, and the scientific advice to the government will be how that can be done through a range of different measures or approaches. But I think it's really important going forward because we still do have infections in the community, 7,000 or 8,000, according to the Office for National Statistics, as I said earlier. It's really important that we monitor infection rates in the community very, very closely. And if there is any hint or any sign that the infection rates are going back up, that the R rate is going above 1, that action is taken to ensure that R goes below 1 again. And that will be the scientific advice, and I'm sure the government would also want to take account of that advice as well in keeping R below 1 so that we can avoid any second peak or any second increase in the virus.
Andy?
Yeah, can I just come back on that?
Of course,
I mean,
yeah.
it just sounds like, you know, the Prime Minister was clearly hoping we would be able to say we've gone from 4 to 3. We haven't done that, and yet we've pressed ahead anyway. It does rather look like the decision had been taken, and whatever with the advice coming, you know, we've pressed ahead regardless.
No, I'm not sure that's right. I mean, when we've made these decisions, we've always done them in conjunction with the latest scientific advice, and Steve and his colleagues are completely aware of everything we're doing. I think the other thing that Steve touched on, which I think is important and certainly has been important in the conversations I've had with Sir Patrick or Chris Whitty, are around our ability to now keep an eye on things, which because of the test, track and trace system, because of our new surveillance operation and the information we're gathering, that's something that has changed from where we were previously. We now have stood up, I think, in a very impressive effort, and I pay tribute to all the people involved in it, this ability to really track what is happening, measure what is happening across the country, and react quickly if need be in a more targeted fashion. And I know that's something that all of the scientists were keen for us to put in place, and helps give them confidence that we can move forward in this way, but we will be able to spot problems and react quickly and in a targeted fashion should the need arise. Brilliant. Turning next to Anna Mikalova from the Daily Telegraph. Anna, hi.
Hi, Chancellor. Many businesses have said they'll struggle to stay afloat with a 2-metre distancing rule in place, in particular in hospitality. This week, the Prime Minister suggested he would like to see the 2-metre rule reduced. Would you like to see it reduced?
Well, I agree with the Prime Minister, and I think what he said was we would keep it under review as we do all of the health restrictions and measures that we've put in place to help tackle the virus. Of course, like anything else, we talk about these things with our scientific colleagues. We understand the risks are involved, and if there are reasons that are sound for adjusting things as we go, as we have progressively made other changes to our restrictions, of course, we'll consider that. But we're not there at this point, and as the Prime Minister said, we keep everything under review. Steve, I don't know if you...
Well, I think Sir Patrick Vallance, the Chief Scientific Advisor, gave a very good description of some of the science and some of the things around the 2-metre rule yesterday. It's not an absolute. 2 metres is not absolute. There's an increasing amount of risk. The closer you are to an individual, and of course, the longer you are close to somebody. That's the basis, for instance, for the contact tracing in test and trace. And there are a number of other mitigations that can be taken around that 2-metre rule. I don't think the scientific evidence has changed, and the scientific evidence will continue to be presented to the government. And of course, if new evidence becomes available at any time, of course, that must be taken into account. But I don't think the science has fundamentally changed.
Anna, anything else?
Yeah. Well, just circling back to your the tax question earlier, you said you don't want to comment on future budgets, which is understandable, but the Prime Minister this week, in answer to that question, reaffirmed that he would maintain the commitment to all Tory manifesto pledges, which include the triple tax lock. Will you also now reaffirm that you will not get rid of that manifesto commitment?
I say, as always, Anna, I agree with the Prime Minister, and would go back to what I said before. I'm not going to write future budgets today. Brilliant. James Tapsfield next from the Mail Online.
Thank you, Chancellor. So far, the public sector has escaped the furlough wage cuts and the wave of redundancies in the private sector. Everyone will want to protect the NHS and frontline workers who protect us during the crisis. But is it really going to be possible to shield the wider public sector from the economic fallout we face? And to Professor Powis, do you think there's a safe way to share a barbecue, or should we perhaps all be looking more to picnics over the coming weeks?
Thanks, James. Our public sector workers have done an amazing job, many of them on the front line, obviously in the NHS, but also in local councils up and down the country, helping us respond. And now school teachers will also be, over the last few weeks, have been making changes and getting ready to work in a new way to welcome young children back to school, which is fantastic. And they all deserve our praise and thanks. I think if you were asking if I understood rightly about future pay and the situation for public sector workers, I mean, many people in the public sector are in the middle of multi-year pay deals. For example, nurses for the Agenda for Change deal is in the midst of it. And many of last year, you remember we had, I think, an inflation busting pay rise for about 1 million public sector workers. There's a process that happens. There are pay review bodies that provide advice to the government, collect evidence, and that process will be underway as normal, and that would be the mechanism through which those decisions are made later on this year.
Well, I think if you're in a garden, a private garden, having a barbecue, whether you're in a park, the fundamental rules around safety remain, which is the 2-metre rule, is to stay distant from each other at all times, to maintain hand hygiene, to ensure your hands are clean, you're washing your hands frequently. So I think it's those general principles around safety and reducing the risk of transmission which need to be applied in any setting as those lockdown measures begin to be relaxed and more individuals can get together, maintain social distancing, maintain hand hygiene.
Brilliant. Anything else, James?
If I may, Chancellor, I was just wondering whether you considered whether it would be appropriate for ministers to take a pay cut in solidarity with a lot of workers who are facing the same as has happened in places like New Zealand.
Oh, I wasn't aware of that happening in New Zealand, but thanks for letting me know. Again, I with all public sector pay, there's probably a process for that as well, which of course we'll look into. So thanks for flagging that to me. Next and finally, Nathan Stanley from Hull Daily Mail.
Yes, thank you, Chancellor, and good afternoon. The first part of my question is for Professor Powis. This week, localised data from the Department of Health suggests that Hull still has a high infection rate compared with other parts of the country that perhaps experienced their peaks earlier on in this pandemic. Does that mean that Hull is still susceptible to the virus as these restrictions are lifted across the board? And does it mean that people in Hull are more likely to see local lockdowns imposed? And then secondly, to the Chancellor, Hull has one of the worst unemployment rates in the country. National Holidays has gone bust this week. P&O has said it's going to need millions if it's going to survive this crisis. The caravan industry, which is a huge employer up here, is really struggling. So, A, what is your message to people in Hull who are struggling during this crisis? And B, you know, the billions that you sort of spoke about today, I know Faisal from the BBC asked about the cost of these schemes. They're sort of a fraction of the 500 billion that was thrown at banks that were responsible for the 2008 crisis. So can this Tory government pledge to support the workers that it's been protecting throughout after the months and years after these schemes elapse?
Thanks. And I think why don't I go first? I mean, in terms of specific support to Hull businesses, like businesses up and down the country, many businesses in Hull would have received holidays for their business rates for the entire year, cancellation of business rates. You talked about the tourism industry there and caravans. So that industry has particularly benefited from a complete cancellation of its business rates. I think around probably 4,000 or so businesses in Hull would have received a direct cash grant from the government of £10,000 or £25,000 if they're smaller or businesses in the most affected industries like hospitality and leisure. And of course, they have access to all the discounted loans and other things that we've done. I think a broader point I would say is just going back to what I said earlier about our ambitions for net zero. In the budget, I outlined a range of investments in our regions up and down the country over the next few years, and a place like Hull will be a beneficiary of that. We talked about carbon capture and storage in an earlier answer, and obviously the region around Hull has seen amazing growth in offshore wind production, and carbon capture and storage again is something that could be a growth industry industry for a place like Hull. So I actually think, there are lots of opportunities that this government will provide for everyone living in Hull and the region to participate in future growth. And with regard to standing behind workers, I think absolutely that's what this government has done. The furlough scheme, which we've talked about today in particular, was perhaps the most strongest expression of our values as a government and our desire to stand behind those working in this country who, through no fault of their own, have faced a very difficult time over the last few months. That's why we put this extraordinary and unprecedented intervention into place, to do exactly that, to stand behind Britain's workers.
And on local infection rates, Nathan, I think you're quite right. There will be variation in the amount of infection around different parts of the country. That's not unusual in an infectious disease. For instance, in the flu season, which we have every winter, we see variation in the amount of flu in different parts of the country as we go through the winter months. I think the second important point, though, is that our estimate of the R number across all regions in England and parts of the UK is that it is below 1, which means that although there might be some difference in underlying infection rates, the trend is downwards in all parts of the country. And then on the point about whether there might need to be local lockdowns or restrictions, I think what we might find as we continue to see a reduction in the amount of infection is much more localised outbreaks. And we know that we can see outbreaks in infectious diseases, and this in one sense is no different in areas where people are living closer together, so dormitories, for example, prisons might be another that we've talked about. And I think that will require local intervention, local public health intervention to manage those localised outbreaks. And in an earlier question, we talked about the Joint Biosecurity Centre, so the JBC and Public Health England. One of their key things will be to ensure that we detect those outbreaks, localised outbreaks, very early, and the appropriate interventions are made to ensure that the transmission between individuals is broken and the outbreaks dissipate before they can become a wider problem within the community.
Brilliant. Thank you, Nathan. I think that brings us to the end of today's press conference. Thanks, Professor Powis, for all your time, and thank you everyone at home for your time, and thank you as ever for going through us together with this, all of us together through what is a very difficult time. But as we are seeing progressively week by week, things are improving. We are able to lift restrictions, and bit by bit we can try and get our lives back to a new normal. But it is a new normal that I believe is filled with opportunity for all of us. We've talked today a little bit about the economy, and as I said, today a new national collective effort begins. We can start to reopen our country and kickstart our economy, get our lives back to normal, and it's something that we will do all together. Thank you very much. Have a good weekend.
Rishi Sunak there trying to bring a little bit of hope and optimism to the end of that daily briefing. Let's recap now some of the announcements made by the Chancellor at today's Downing Street briefing. Well, first of all, the Chancellor announced the daily death figures. A further 324 people have died with COVID-19 in the past day. And that takes the overall official UK death toll from the coronavirus to 38,161. Rishi Sunak then went on to outline changes to the furlough scheme. He said employees will continue to get 80% of their wages, up to £2,500 for June and July. From August, employers will have to pay national insurance and pension contributions, and then 10% of pay from September, rising to 20% in October. And the Chancellor said he intends to end the furlough scheme in its current form in October. Rishi Sunak also announced that workers will be allowed to return to work part-time from July, still under the furlough scheme. And the self-employed will be eligible for a final grant in August, covering 70% of the applicant's average monthly trading profits.
See the headlines as they happen and watch BBC News live in the app and get the full story with bbc.co.uk/news. Follow the story for all the latest with BBC News.